So today we'll be talking about resiliency during times of transition. I do have some relationships with commercial entities that produce healthcare related products or services that you should be aware of, although I don't think any of these really have any influence on what we're talking about today. But I have some roles on advisory boards. I do some consulting work for some various companies within the industry. And then I'm also a lecturer and volunteer for both the AARC and the Massachusetts Society for Respiratory Care. Our objectives today will be to define burnout, compassion, fatigue, and resiliency, to identify 3 symptoms of lack of resiliency in RT students and recent RT graduates, and to discuss a 4-step framework that can improve resiliency. It's important to know that there's a difference between burnout and compassion fatigue. Burnout is certainly available in the literature. It's talked about a lot in both, scientific literature, but also in mainstream news media outlets. And there are some within the medical literature, there are some definitions that relate to burnout. Things like the inability to provide the care that you wish to provide, or a discrepancy between the expectations and ideal of yourself, but then the actual requirements either of your job or what you may be asked to do. Burnout is mostly related to things such as physical, mental, or emotional exhaustion related to stress. This can adversely affect patient outcomes, reduce the staff well-being, and really have a negative impact both on the staff themselves, the healthcare team, and then the entire healthcare system functioning. Compassion fatigue is something that's talked a little bit, it's not as frequently talked about. And the difference is that compassion fatigue is that which you feel when you feel helplessness in a situation in the face of suffering. So, taking care of very sick patients, which is what we do all the time, every day, that can certainly lead to compassion fatigue when you feel like the patient either isn't progressing as quickly as you would like, or their disease process is so severe that you're starting to feel this this sense of overwhelm because they're not getting better as quickly. There are many symptoms of burnout and compassion fatigue. They look the same. And what is really important to know is that any individual can experience one or both of these, and that you can experience it in very different ways. So although what I might feel may be different from what you might feel, that's okay. What's important to know also is that it's not burnout or compassion fatigue is not strictly related to one individual. It's rooted in the systems and the environment that we are in. So it's not just, resiliency and beating burnout or compassion fatigue. It's not just about, fixing yourself, but it's also about really critically evaluating those things around you, the environment that you're in, the systems that you work in, to try to understand where some of these triggers may be coming from. You can feel, you can feel things such as insomnia, depression, depersonalization or disconnection is really a large symptom of burnout, difficulty concentrating and sleeping. It can also flow over into actual physical clinical symptoms, things like headaches, body aches, some heart disease related things, actually AFib, coronary artery disease, hypertension, and even stroke, depending upon the severity of this and the duration of burnout and compassion fatigue. As I mentioned, these kind of buzzwords are all across the scientific literature. This was related to COVID, before COVID, but mostly we're looking at role groups like nurses and physicians. There wasn't much, data out there to discuss how RTs fit into this picture. There was an article in 2020, and this came out in the middle of 2020, but it reflected data that actually was before COVID started. And so, you'll hear people, relate burnout to the COVID pandemic, but this actually was starting a little bit beforehand, given the job that we have to do every single day. And of a survey of 200 licensed RTs, 36 of them met diagnostic criteria for PTSD, and that was higher than nurses and physicians. Um, Once COVID kind of started coming along, there was a lot more discussion and digging into how RTs were feeling and responding to the pandemic. And you can see the numbers are pretty astronomical. In 2021, 80% of respondents to a questionnaire reported burnout, and 10% of those were severe burnout, with 32% being moderate and 37 mild. In another study that came out in 2022, a questionnaire was given. I think this is very, very interesting to physicians, advanced practice providers, respiratory therapists, and pharmacists at 3 different time points, and to evaluate the burnout at those 3 different time points. 74% of the RTs who responded reported burnout and had the lowest rate of professional fulfillment. And this is what I think is really interesting as they looked at these 3 time points and kind of the longitudinal aspect of this. The respiratory therapists were 3.7 times more likely to experience burnout than all of the others. So, we definitely, although it wasn't necessarily highlighted in the literature before the pandemic, it certainly has now come forward. Another survey done in 2022 looked at burnout, again, in an RT department in one healthcare center in Saudi Arabia, but it actually divided the burnout into a couple different domains, things like emotional exhaustion, depersonalization, and low personal achievement. So here's your first checkpoint. Make sure that you answer this to get the credit. And the question is true or false. Burnout is a problem with the individual who is experiencing it. I still see the answers coming in, but so the answer is actually false, right? It's not just the individual who's experiencing it. It can be the environment that the individual is in. It can be, the specific systems that they have to work in, the workflow that is there, and that can really be a significant, trigger for burnout. So we've probably all felt this way, and putting this together, I thought, like, this is exactly how I feel when I'm burned out. Like, so I'm already in a hole. Now what? What's like the next step? How do I get out of this hole that I'm already in, and prove myself a little bit more resilient? And resiliency is not just a thing or a trait. It's a process, which is very important to also recognize, and hopefully will give you some sort of mental relief that if you don't feel resilient in any one moment or around any one thing, recognize that this is a process. It's not just, do I have resiliency or not, but rather a way that you can work on this and evaluate this and use strategies to feel more resilient or to not feel so burnt out and overwhelmed. It is a very dynamic process that really encompasses the capacity of how individuals look at stress or adversity and then turn that around and adapt positively to it. This final quote names resiliency as a multidimensional construct, which I think really encompasses everything, because it's not just one thing that you're doing, it's many different things that you're doing. And again, over a significant period of time to feel better about some adversity or trauma or sources of stress that you may have in your life. So the question is, and this isn't a checkpoint, but the question is resiliency a personal trait or a learned behavior? You might think, my friend or colleague seems a little bit more resilient than I am, or this one instance or one situation doesn't bother him or her as much as it bothers me. So is resiliency a personal trait? Or is it something that can be learned and shaped? And I think the answer to this question is it's both, right? It involves behaviors, thoughts, and actions that anyone can learn and develop over time. But how do we get there, right? That's like the biggest thing. Like we all know being resilient is important, but how actually do you do it? These are strategies that improve resilience, and I highlighted the ones that probably you have heard of, things like stress reduction training, relaxation techniques, time management, meditation, work-life balance, right? All of these things can certainly improve your resilience. However, I will say, and this is a saying that's commonly used at my institutions, but you can't yoga your way out of this one, right? Sometimes situations are so intricate and so filled with compassion fatigue or stress that like yoga or, some of those meditation techniques isn't enough, right? You have to have other strategies that go along with all of those others to help you be more resilient and be able to get over that type of adversity. So I will present to you a four-step framework. There are many out there. This isn't the end-all be-all by any stretch of the imagination. It just resonated really with me, and these are some things that I use in my day-to-day world, and I think it really kind of sets out a nice plan for you. So the first one is to mitigate micro stress and avoid overwhelm, right? So if that hole was less deep, we wouldn't have to be so resilient to get out of it. So how do you make the hole less deep? What causes you stress? How can we get over those, or how can we avoid them? I will this example here of getting rid of stupid stuff. That's actually the name of a journal article, a manuscript that was published several years ago, and it was came from a hospital in Hawaii. And what they did was they were looking at their electronic medical record, and some of you might be, more experienced with different types of electronic medical records, but if you've used them, you know that there are several steps to get to where you need to go because there's a lot to do. And this group in Hawaii, when they looked at their electronic medical record, they noticed that there were significantly more clicks than they really needed. So they really did a critical evaluation and tried to streamline many of their processes. Now, the first thing that it did was it allowed them to focus on those things that were important. You know, when you get those pop-ups, you just click, okay, okay, okay. You don't actually read what the pop-up says. And that was what was happening with them. There was certain alerts for their patients. They were just clicking by. So it actually made it more safer for patients. The second thing was just from all of these extra clicks, they saved 1,700 hours, nursing hours per month. So that's how their electronic medical record had evolved into all of this extra work. So you do have to think about things and understand like what do I do just because that's how I've always done it? Could I do it a little bit differently? Evidence-based practice is something certainly from a workflow standpoint that you should be looking at. What are we doing that perhaps takes up some of our time, adds additional stress to our workload and our environment, but that isn't based on evidence and doesn't change patient outcomes? Are there things that we should think about de-implementing and getting rid of so that way we can have more focus on those things that are meaningful to our patients and our organization? Other things, and I'll kind of get to this in a bit, but maintaining and setting boundaries is incredibly important. Things that you need to do for yourself are things that you need to identify, and don't just say it, but actually do it. One thing that as I try to be available to my staff, but sometimes with texting and phones and cell phones that are so close to us now, it seems like I'm always connected to people. And there are times that I have to set boundaries for myself and my family. And if someone perhaps sends me a text or something along those lines when I'm not at work and it's not urgent, right? These obviously an urgent thing I would address, but when it's not urgent, I say things like, thank you for letting me know. Can you send me that in an email so I get it when I get to work next? So you don't have to address it. You don't have to, handle it. You also don't have to ignore it, but there are ways that you can set that boundary and maintain it so that way you can you know that it will be there waiting for you, or whatever the case may be. Delegating tasks is very appropriate. I have no business in doing this, but when I was taking on a new job and I had a new baby, one thing that I had actually employed was a laundry service, right? The laundry people came and they picked up my laundry, they washed it, folded it, and brought it back to my house. And it was something that I used for like a short period of time just to kind of get over that hump. But delegating that task was so important, and it just took some stress off of my life. So think of things outside the box that might seem kind of outlandish or over the top, but if it's one of those things that sticks with you and causes you a lot of stress, delegating that to someone else may be very impactful to your burnout. It's also important to say that complete lack of stress is unavoidable, right? We work in a stressful environment. We live in a very stressful world. And so you will never be able to get rid of stress altogether, but it's how you get rid of the stress that you can get rid of, and then manage the rest of the stress that you can't get rid of necessarily. Step two talks about fulfillment. Now, fulfillment is not the same as success, which is very important to recognize. You can be very successful, have all of the titles, have all of the credentials, have all of the everything. But if what you're doing doesn't bring you joy, you will experience burnout incredibly quickly. I've, been networking with students for several years now, and I just spoke to one not too long ago, and he said, "I can't wait to go back to school and get my next degree and be, the manager of a department." And I thought to myself, like, slow down a little, right? Like, as you see at the bottom, it says, "Ignore the destination and enjoy the ride," right? Um, you have to enjoy what you're doing, or you will get burnt out so quickly. Know what drives you. So, what is it that kind of makes you tick? What brings you joy? And choose to be involved with those things. It doesn't necessarily mean that it's separate from work, right? There's a lot of things that I love, like doing this at work, that really, although it might be quote unquote work for me, it still fills my cup as I'm doing it. And so, there are many different things that you can do to help with that fulfillment. Now, there will also be things that you have to do because they're part of your job that maybe don't necessarily bring you fulfillment, but it's important to also recognize that, get that done, and then work on those things that bring you joy. Step three is cultivating community connection and belonging. This actually dates back thousands of years ago, actually, to the Neanderthal period, where survival was linked to being in groups and in tribes together. Um, Same really rings true now. Having supportive relationships, either at work and or outside of work, are very important to your burnout. It gives you an outlet to talk to people, to share things. And it can be, a venting session where you're talking about, things that happened at work, or stressful things for you. But they can also be other things that promote belonging and give you a sense of purpose and self-worth, and that are totally unrelated to work, right? And that you're kind of giving back to your community or giving back to a group of people. The other piece about connection and belonging is being vulnerable, which is something that is very challenging to do. And I won't even say just as new graduates or as students, because sometimes when you go into a new place, it's challenging to be vulnerable because you don't want people to think that you don't know what you're doing, right? You want to try to put your best foot forward. But being vulnerable and saying, "I'm not sure of that," or "Can you explain that to me more?" or "I would like to see your perspective on this," allows people to have a deeper connection with you. And then this really creates a space of psychological safety, where then other people might share things with you and they might be more vulnerable with you. So being yourself is very, very important, and being honest with how you're feeling or what you're thinking about a specific situation will make your burnout much less. I should say will improve your resiliency. How's that? And then the final step is building a resiliency or resilience bank account. What are those things that really help you? And when you need to say, make a withdrawal, if you will, you can really go to those things and pull them out. Things that foster wellness, right? These are behaviors and habits that we should practice all of the time. Identifying and practicing hobbies is very important. It's not just about knowing, like, oh, yeah, I could do yoga, but actually like, doing the yoga is really what's going to help your resiliency. I am one, and I'm not really creative at all. But one thing that I do is, as silly as it sounds, paint by number. It allows me, and this is just, my individual sense of how my brain works, but it allows me to see progress. But it's also very mindless because there's not a lot of thinking or high level processing that goes along with it. I don't have to worry about, what color blue am I going to use because it tells me what to do. And it's easy to do and it's very portable. So I mean, you can buy the kits on Amazon. It's so easy. So find out what resonates with you, what helps you, and make sure that you know what it is and then do it when you're feeling overwhelmed or when you're feeling like your resilience needs, a little bump up. Positive thinking prepares you for future stress. If you get into an example or a situation where the stress is very, very high and you have a negative outlook on it, the stress level is going to increase. If you can come into situations, even stressful situations, with a positive attitude or positive outlook, that stress is likely to not impact you as much and is likely to not, add to your burnout. As I mentioned, reflection and self-discovery is important because although burnout is not an individual's fault, it is individual in terms of how do you increase your own resiliency, because the answer is different for everyone. You also have to have this practice of reflection because, as I mentioned before, sometimes a same example might impact me differently than a colleague. And so knowing what impacts you most is very helpful so that way you can either avoid it or understand how to deal with it in the moment. Emotional intelligence is another thing that helps build that resiliency bank account. And for those of you who are unaware, Dr. Goldman put this emotional intelligence framework together, and it really has four constructs. First is self-awareness. So how do I know and do I know that what my moods or emotions or drivers are? Do I know how one situation is going to impact me? The social awareness is, do I understand how this is going to impact someone else? Right? How do I treat people with empathy so that way they know that I care about them? Self-management is the third construct, and that's really the ability to control disruptive impulses or moods. We've probably all been there that, one thing might tip you off, right? And I mean, I can think of 600 examples, to be honest. But do you have the self-management to sit back for a minute, a day, a week, and say, like, okay, I'm going to process this a little bit. I'm going to get rid of my judgment, and to think about this before I start acting and moving forward. And then the fourth construct is relationship management. And that really is looking at your networks and how you're building that, how you're sustaining those. And you can see they all kind of go together and fit together because you have to have some degree of all of this to have emotional intelligence. So hopefully this 4-step framework is really helpful. Things like mitigating the micro stress, adding fulfillment, adding community connection, and then having that bank account that you can withdraw from, hopefully will increase your resiliency. However, we have to say, this paper just came out not too long ago, but employers have to be very, very careful with how they're labeling burnout. And that you can see the title of this is Burnout or Exploitation. It is unfair for an employer, a boss, a manager, even a colleague to imply that burnout is any one individual's fault or their own doing, right? We have to look at and be honest with the perhaps unhealthy work environments that we may have. And this could be something, it's hard as an employer to say, yes, I have an unhealthy work environment for my staff, but what we do want to say is I'm trying my best, but what are the downfalls or what are the places that we could try a little bit harder or implement another strategy in and not just say, this person burned out for this reason. And it's them, right? They're not resilient enough. So resiliency may not be the solution, may not be the only solution. I think it's part of the solution, but also combining, looking at what the work environment, what the requirements, what the components of that are. Back in 2021, right after the first wave of the pandemic, a group of respiratory care leaders did look at burnout amongst RTs. And these were the key drivers that they listed. And you can see a lot of it has to do with workplace environment, poor leadership, staffing, high workloads, lack of recognition, lack of appreciation, stress, high acuity, lack of autonomy. So all of these things that are really high drivers for RT burnout are more related to the environment and not to any one individual. So I will give you another checkpoint, true or false. Strategies for improving your resilience only involve you. Awesome. It looks like the great majority is coming in with false, right? The strategies do certainly involve you and understanding what you need as an individual, but they also involve the people around you, your friends, your family, your employer, your manager, your colleagues. All of those people can contribute to the environment that you're in, the stress level that you have to undertake. Great job. So what I wanted to do is to just run through some thoughts as you're considering places of employment. And, as I mentioned, the environment is so key in this and it's hard to grasp the environment in a short interview, right? You might have a half an hour or an hour. Perhaps you've done clinicals at the place that you're considering for employment. These are some things that you can think of, as you're at your clinical rotations. Maybe you already have a job and you're already working as an RT, you're a newer RT, and you're evaluating, like, is this the right place for me to be? So I just kind of threw some thoughts together that I would like to know if I was going to take a new job. So first is, what is staffing like in this department? We all know that RT staffing can be very, very challenging. There's not enough RTs, and probably in the next coming years, as several folks start to retire, there'll be even less RTs. So, excuse me, you want to understand, what are the patient to RT ratios? How are assignments made? Is there an objective way to go about making clinical assignments, or is it just based on what the resource or the charge therapist thinks is best? I will say that I use kind of a combination of those two things. We certainly have a ballpark of ratios, but we do not have, at my institution, we do not have one set ratio. We look at the number of patients, what the acuity of those patients are, and also what therapy they're receiving, right? Because 4 ventilated patients does not equal 4 aerosolized medication deliveries. So we do look at the type of patient and the acuity that they have to figure out how we're going to make assignments. You also might want to try to understand what is the agency RT use in that department. If there is a high number of agency use, it may mean, and I'm generalizing a little bit, but it may mean that the department has challenges in recruiting people or retaining people, in which case the likelihood that you're going to be overworked will probably be high if there's a lot of turnover and a lot of staffing vacancies. What does employee engagement in the department look like? Do staff participate in changes? Are staff encouraged to share things that they see may be going wrong? I just got an email the other day of a staff person who said, I noticed this and I thought that this was a great solution. So is there a leader that embraces solution orientation and solution-based thinking where you can offer a suggestion, you can point out perhaps what's wrong. Sometimes that's really challenging as a leader to understand and to hear. Um, but then also just change result from those shared thoughts. If you're constantly sharing what you think and your manager or leader or colleague or whomever does nothing about it, then they're not really open to what you have to say and what's bothering you, maybe what's contributing to the burnout of you and your colleagues. This also can, as we talked about in step 2, can increase your fulfillment. If staff can participate in the change making in the department, you can really hone in on what you like to do. We have a new delivery room project going on, and I have one staff member who just loves the delivery room. And so our intention is to ask her to help join us with this quality improvement initiative because I know that that's what fuels her. And so if employers, excuse me, allow staff to participate in the actual doing of change, your fulfillment will certainly go up. How does leadership interact with staff? Do they provide an environment that has psychological safety? Meaning, are you allowed to share when you don't know something? When you make a mistake, is it punitive or is it welcomed to share that I made a mistake? Do leaders admit when they make mistakes? Because we all make mistakes, we're human. Do you feel that your leadership is trustworthy and authentic to helping you or to running the department? Do they provide clinical support? That's something that, there's probably a hierarchy within the department of, when things are getting really crazy, who's kind of going to jump in next. And there's, like I said, a hierarchy or a process by which you gain more staff. But is the leadership willing to jump in when, the clinical support is needed? If not, that means that the stress level for any one person is going to increase. What does time off look like? Back to those boundaries. Are you expected to be checking your email once a day on time off? Do you have flexible scheduling where the schedule makers of the department value what you have going on outside of work and that they allow you to have that flexibility in improving your work-life balance? Are there things like mandatory overtime where, without question, you have to come to work? Sometimes that is necessary, I'll say. We have a call system at work, which if my institution, if you get called in, it's essentially mandatory overtime. But that is to ensure that our patient to staff ratios are okay and that no one is overworked. And so when people are here, they're not getting burned out. Maybe about a year ago, I implemented a second layer of call, which was not it was not a popular decision, to be honest. But and I know that mandatory overtime can certainly impede people's work-life balance. But what I was hearing really month after month were people were here and completely overwhelmed. And people were saying things like, I have 12 patients, I'm probably not even going to get to see all of them. And I'll just do the best that I can, but they certainly won't get the care that I want to give them. And that's not okay for a leader to hear and to do nothing about. So there is a balance in some of these things. And again, you have to understand what this might look like for you and what may be acceptable or not acceptable to you. How does the department or organization recognize its staff? Um, Recognition is very important, and there are things like, giving rewards or sending nice emails that signify recognition. And when you do a good job, the organization or department or leader, sends that to everyone. We have multiple ways of doing that. We have a shout out box at our staff meetings every month. We go through all of those and really kind of get it out into, that public recognition. For some people, though, that's not meaningful. And recognition might mean something like you're helping me advance my career, or you're giving me an opportunity to work on a quality improvement project. Those things might be more meaningful to you. So, again, it just depends on what you as a person like. But one key, and I have to say this is very, very important for you to evaluate. Does the leadership, the department, the organization even know what to recognize you for? Right? Are they in tune to the department and to the staff enough that they see what you're doing? And I don't see in terms of physically seeing what my staff do, because we're so decentralized and all of my staff are out in ICUs doing great work. But I know what they're doing, and because of the network and having many relationships around the institution, I do know what's going on, and I know the great work that they are doing, and then can recognize them for that. So, but if leaders don't, if you're walking into a department as a new grad who they don't know what their RTs are doing, that level of recognition, of course, is going to be much lower, and you're not going to feel as fulfilled or as proud of what you're doing if it really goes completely unnoticed and unthanked. Another thing that I like to do for recognition is to push these things upward. So I feel sometimes like the bragging mom, where, I send various emails or initiatives or things to my boss, who's the chief nurse officer. I sent things up her way so that way she knows what the staff are doing and can also recognize them at various time points. Do I get to work autonomously? That was one large driver for the RT burnout that was listed. As I mentioned before, driving change is something that's very, very rewarding and fulfilling. But in the day-to-day work, even if you're not involved with change management or that's not something that appeals to you, do you get to use critical thinking? Do you get to use all of the things that you learned about in school to actually take care of patients and make an impact on patients? Or is this an institution where, you work based on physician's orders? I would say at my institution, there's a combination of both, where mostly we work by protocols, but there are some things that are very physician driven, and that's okay too. You can still learn from those things, you can still make an impact, and you can still advocate for your patient and work as part of the team because you have that autonomous care delivery also. Now, shifting a little bit to the organization, because as much as, I as a department leader want to change the world for all of my staff, sometimes I, kind of bump up against the organization and what I can do, in relation to what is allowed for other departments in our organization. So it's also important to understand the organization when you're looking for a place of employment. Does the organization elicit staff feedback and thoughts? Do they offer things like opportunities for projects, opportunities to be involved in things like your state society, be involved with the AARC or the MBRC? What do they do? How do they support continuing education? Are there things, that things like mentoring or residency or in services that they do on a regular basis that can help support your growth and your continued career progression? You also want to know, how does this organization support my stress? Right? Again, I as one leader cannot do everything to support the stress of everyone in my department. But what does that look like from an organizational level? We have what's called an employee assistance program. There's probably several names for that, things like a wellness committee. We have I'm blanking on the name, but we have staff people who are support folks. They've gone through, a short class, but they're peer supporters. So there's many different ways to do it, but it helps when it's at an organizational level. Another thing that's a large driver and to help your resiliency and overcome burnout is actually debriefing of those difficult patient situations and scenarios. When you have time to either decompress, if you have a really difficult patient, if your colleague says, why don't you just go for a walk? Give me your pagers. You can, go for a walk, clear your head. Or if the care team says, we had this difficult cardiac arrest, let's all come together and walk through this and understand what happened, what went well, what didn't go well. That debriefing moment to just de-stress and to vent and share your thoughts and feelings can be so powerful into your resiliency. Another important thing are what are the major changes coming to the department or the organization, and what does the preparation look like? We are in the process of building two large buildings, and it's certainly overwhelming, I'll have to say, in preparing for it. But I feel okay because the respiratory therapists have a voice. There's a lot of support for us as among many other departments, of course, as these buildings go up, but we're not forgotten about. Sometimes, the RTs just kind of go with the flow so much that in these large preparations, we tend to be overlooked. So I would try to understand what's coming down the pike, and is that something that you want to be involved in, and is the department viewed well enough that that you won't run into increased stress or burnout down the road because of these changes. And then what is the organizational culture like? There are many, and historically in medicine, we've had this very hierarchical culture where, the physician says one thing, then the nurse says one thing, and then the RT says one thing, and it's very stepwise and so you want to know, is that still the case, or is it more related to teamwork and collaboration where everyone's voice means as much and it's not just the doctor's voice means more because they're the doctor? What do professional interactions look like? Is it okay for you to ask a physician a question? Is it okay for you to disagree with perhaps what the physician or the advanced practice provider or the nurse, what they recommend? Is it okay to have those collegial but professional discussions where you can work things out and advocate and get the patient the best thing that they need? That's certainly a culture that will feed into your resiliency, and the opposite culture is certainly more likely to make you feel burned out and have that compassion fatigue. So here's the final checkpoint. True or false? You should reflect on yourself and your environment frequently to identify areas that are challenging your resiliency. Did that checkpoint go up? Okay, so the answer is, of course, true, right? As you change, as your environment changes, it's really important that you critically evaluate this and understand what might at one point be making you feel more burnt out, or might be adding to your resiliency, perhaps. And maybe you found a new hobby, and that's certainly something that you want to remember and of course take with you. So in conclusion, resiliency can be a learned skill, but this must be intentional and frequent, right? You can't just, think about it anytime that you're burned out. It's really a process and an evolving, as I mentioned before, very multi-dimensional process. Um, Resiliency is also a function of your environment, and it's incredibly important for your employer to recognize this, to value this, and also add to it, right? If they're not going to partake in your resiliency, then that might not be the employer for you. It wouldn't be the employer for me. Embrace what fulfills you and work towards that. With self-reflection, you can determine what you may need the most, and then employ those certain strategies to improve your resiliency and not get burnt out. As I mentioned, you cannot avoid stress. Compassion fatigue is part of our job. We see a lot of very heavy things, but there are also many success stories, and patients that we certainly help get better. So thank you very much for sharing your time with me.